Good afternoon, everybody. Welcome to today's Facebook live session on minimally invasive cardiac surgery. With us, we have today Dr. Yusuf, who's a senior consultant cardiothoracic surgeon at Apollo Hospitals, Chennai. Cardiac diseases form a major threat to our nation's health. Over a period, cardiac surgeries have been traditionally performed through the traditional open heart approach. But over a period, we've developed new approaches like minimally invasive cardiac surgeries, where the traditional approach has not been required. Although 60 to 70% of patients would be suitable to undergo such procedures, the suitability of these patients depend on various factors. So to discuss this and much more, we will go to Dr. Yusuf. As I said, he's a senior consultant cardiothoracic surgeon. He specializes in minimally invasive cardiac surgery and mitral valve repair. Welcome, doctor. Welcome to today's Facebook live session.
Good afternoon. Thank you.
To start off with, the first question from one of our viewers is: can mitral valve replacement done through the minimally invasive approach?
Yes, that's in fact, minimal invasive cardiac surgery started with one of the common procedures being mitral valve repair or replacement. Certainly, it can be done.
To know more about the minimally invasive approach, doctor, could you explain how it's different from an open heart surgery and what is actually a minimally invasive cardiac surgery?
Minimally invasive surgery, in layman's terms, is like laparoscopy in the abdomen. Previously, they used to cut open the abdomen to do surgeries. Now, they use small holes and camera to do like a gallbladder or something like that. It is similar to that in the chest. So we make a tiny cut, about 5 to 6 centimeters, and put cameras like laparoscope, do the procedure. Either a thoracoscope or robot is used to assist with the procedure in viewing and doing whatever is required. This is minimal invasive cardiac surgery. The major advantages, it avoids the full cut in the sternum, which is the deep cut in the middle of the chest. That's the biggest fear or morbidity for any patient undergoing cardiac surgery. It is for that reason they take about 3 months to recover. So that whole thing is completely avoided by making a tiny cut on the right or left side, depending on what surgery is required, through camera holes.
You've touched upon a few benefits of the approach, doctor, but could you elaborate on why someone would want to do this and what kind of benefits does the patient have by going through this approach?
Yeah, the major benefit, as I've already said, is avoiding the cut and early. It is a short recovery, less pain. I don't think anybody would want to undergo pain and stress of undergoing a major operation. So that way, this procedure, there is negligible pain and hardly any blood loss, very little risk of infection or nearly zero, and early recovery. There's a short hospital stay of about 2 to 4 days for most of these procedures, and they're back to normal within 2 weeks' time. So we can get back to work, do whatever you've been up to in 2 weeks' time. Whereas with open surgery, it takes 3 months, 2 to 3 months. That's the biggest advantage between the two.
Okay. So what kind of patients are suitable for minimally invasive cardiac surgery?
I think in this day and age, most patients are suitable for minimally invasive cardiac surgery. There is a small group of patients which we may not be able to perform safely, because at the end of the day, safety is key. So even for minimally invasive patients, we say if there is any problems, then we may have to do the conventional procedure, like laparoscopic procedures. So the safety is the key. If we think safety would be compromised by doing a minimal invasive approach, which can be in about 15 to 20% of patients, then we don't opt to do minimal invasive and advise a traditional approach. In all other patients, especially mitral valve surgery, almost 90 to 95% of patients, we tend to do minimal invasive surgery.
Is age a deciding factor, doctor?
No, in fact, age is better. Age, since the risks of recovery or morbidity is much less with minimal invasive surgery, aged patients benefit more. The patients who we think would have more problems by traditional open surgery would benefit more, like elderly people, patients with other comorbid conditions like even uncontrolled diabetes and things like that, and big patients. These are patients who would actually benefit more by minimal invasive surgery because they recover quickly with least problems.
Okay. Are there any disadvantages for this approach, doctor? Is there something the patient should be worried about or concerned about or should be careful about?
I don't think there is any major disadvantage. It is a little bit more expensive than the open surgery, but on the long run, if you look at quick early recovery, every study has shown economic benefit to the patients by going through this approach. Apart from that, there is no major disadvantage, but unfortunately, as I said, there's a 15 to 20% group of patients who we may not be able to offer this procedure. But I think overall, still people are not aware, and they do think. I do have patients asking me, "Is it safe?" Because they are not aware and they think it is new procedure. It is not. It's been practiced for more than 2 decades now. So it is. Most surgeons are off the learning curve like us, and this is our routine procedures. So we should be in a center where they do this routinely. Then it is more safe than risky.
Thanks, doctor. The next question is about valve diseases. Could you explain what valve diseases are, doctor? Like, what does a normal person face in terms of valve diseases?
In a normal human heart, there are 4 chambers, and to allow unidirectional blood flow, that is blood flow through one direction, there are valves in between each chamber and at the outlet of the chambers. So there are 2 on the left side, 2 on the right side. These valves can either become leaky over time due to degeneration or can become narrowed, stenosed with calcification, again age related, or there can also be problems due to rheumatic heart disease, which is a childhood disease. It used to happen more in our country. Now with economic developments, it is becoming less and less. The degenerative problem is an old age problem where it's more leads to leaky valves and less of narrowing of valves. And also there can be infection in the valves which can lead to the same problem, or even following heart attack patients can have valve leaks. So these are the common problems and these are the ways that they can occur in most people.
So in case of a leaky valve or a malfunction, is replacement the only option, or could it be treated medically before going for a surgery?
For any problem, there is currently a medical treatment which is with tablets, and also catheter-based treatment which is done by cardiologists, and surgery. In surgery, there is minimal invasive surgery and traditional open surgery. So we have moved on to have various treatments. If a patient or a person has leaky valve or narrowed valve, there are indications to say when we should intervene. The patient, mainly if they get symptoms like usually breathlessness, breathing difficulty, or even chest pain, tiredness, palpitations where they feel the heartbeat going fast. These are the common symptoms. If they do get symptoms, or if the heart shows signs of failure in the echocardiogram, like dilatation or failing, low function, then it is time to intervene. At that time, we do tend to look at which way to intervene, and often it is surgery in this day and age. Mostly we can deal with them through minimal invasive approaches.
So how is it different from the mitral valve replacement, of minimal invasive surgery and mitral valve replacement?
Yes, so minimal invasive surgery, as you already asked, not all valves need to be replaced. In degenerative valve disease, a lot of them can be repaired. It is nothing like having our own native tissues. Replacement is putting foreign material like joint replacements and so on. So there is always a risk of infection and we have to be careful. Sometimes we may have to take anticoagulants, which is like blood thinning tablets for life. That has their own problems. So to avoid all that, whenever possible, we best tend to repair the valves, which we specialize in as well. And this is very much possible through a minimal invasive approach because the vision is better by using a camera or robot, and the repair is foolproof because everybody can see it. Of course, we always check the repair at the end of the procedure with an echocardiogram in operating theatre. So best repaired. If we cannot repair the valve, then we will have to replace it, in which there are two options. One is a biological valve, which is man-made valve from cow or pig's tissue. And the other one is metal valve, mechanical valve. It is not metal actually, it's polycarbide material, but we call it mechanical because it has valves and mechanics involved. If patients require those valves, we tend to look at it in two ways. Younger patients, better with mechanical valve because ideally it tends to last life, but the disadvantage is they have to take blood thinning tablets for the rest of the life because these mechanics should not get clots within the blood. So we have to keep the blood slightly thinner than normal, for which they will have to take tablets every day. Again, if they don't monitor the levels regularly and keep them within the limit, there is risk of stroke. That's the biggest disadvantage with the mechanical valve and anticoagulation. So in patients above, above 60, or even nowadays above 50, because the valves are better, bioprosthetic valves, then we tend to use biological valves, which tends to last about 15 years to 20 years, depending on the age of the patients, and then they may need to be replaced again. In this day and age, with minimal invasive surgery and the newer technologies, even replacement may not be a major risk at 15 years or so. So currently we are advising more and more patients to undergo biological valve replacement, even younger age group, than mechanical valve replacements.
Thanks, doctor. If one person is preparing herself or himself for surgery, what are the steps which he should be thinking about? Or what precautions should he be taking?
The patient precautions, I would say, if they are referred for surgery, first, don't delay. That's one common thing I've noticed in our country. Patients present late due to fear or neglect. Nothing is going to get better by neglect or fear. So we have to overcome the fear and see the specialist as early as possible, because not every valve problem needs to be undergoing open, big procedure, as I've already said. So most of them in the early years can be managed with medical management, or even catheter-based treatments are available, minimal invasive options. So first thing is to see the specialist and then follow their advice. If they're prescribing tablets, follow them. And depending on, not all of them need surgery, as I already said. We put them as per the indications. If a patient needs surgery, then we would advise surgery. And also we will normally say how soon it has to be done so they can have a normal life. Because most of these valve problems, if detected early and before heart failure sets in or before symptoms get worse, they can be getting their normal life back by dealing with them early. So that's what I would advise as a major precaution. So to take specialist advice early and follow the medical advice given to them.
Could you explain about the procedure time, doctor? Procedure in the sense like including the hospital stay and how long would they have to stay in the hospital and when would they be able to return to normal life for both minimally invasive and for mitral valve surgeries?
Yeah, as I've already mentioned, the major problem with open surgery is a long stay in hospital and longer recovery. Usually for those procedures, hospital stay is 1 week to 10 days and recovery 2 to 3 months. But with minimal invasive surgeries, often the hospital stay is 2 to 4 days and the 1 day in ICU or 1 or 2 days on the ward. That's the usual stay, and they recover very quickly. Usually when they come back to see the specialist in 2 weeks time, they're back to normal. They can get back to full normal activity. That's the biggest difference between the two.
One of the viewers who tuned in would like to know the success rate of mitral valve replacement surgeries.
Success rate of mitral valve replacement surgery, you mean minimal invasive, I believe.
Yeah.
Minimal invasive success is the same as open surgery success. So in this current day and age, there is a risk scoring system which we follow for every surgery. The risk related to mortality risk, which is life risk, for a normal mitral valve replacement or repair patient is less than 3%. So that's where it is. So over 97% chance things will go well. But we are not God. There is nothing 100% in life. So then for that reason, we have a risk scoring system which we follow. So for a patient of around 60 years of age with good heart function, the risk and no other major comorbidities, risk could be about 3% for a mitral valve repair or replacement. But the immediate risks like, as I said, bleeding, infection, pain, all those is much less with minimal invasive surgery as opposed to open surgery.
You've mentioned about the precautions, doctor, and we spoke about the procedure and the recovery time. After surgery, what should a person who's undergone surgery look after, doctor? How should he recover? Like, how often does he need to visit the doctor for follow-ups?
Yes. So unlike other general surgery or other procedures, heart surgery, you need, once surgery is done, yes, it's good, but they need to be followed up by a cardiologist, preferably, not necessarily surgeon, for life. It doesn't mean you have to visit them frequently. Initially, we may be seeing them more frequently, maybe 2 weeks, 3 months, 6 months. And then it's usually a yearly follow-up with echocardiogram to make sure the valve is okay, the heart function is okay. And often if they have symptoms or previously delayed presentation with mild heart failure, then they may need to be on tablets for life. Often valve surgery patients may need to be on tablets, 1 or 2 tablets for life. These need to be followed regularly. 3 things are very important after any cardiac surgery, whether it's a bypass graft surgery or valve surgery. Exercise, food habit restrictions, which is not like you don't need to be on a diet, but sensible eating, and tablets. These 3 are very important for the rest of the life. As long as someone takes care of these 3 and follows them regularly, they should be okay for life.
We have the next question, which is about mitral valve regurgitation. So what does that mean, doctor?
I think that's something we have already discussed. Mitral valve regurgitation is the layman's term of valve leak, where there is a leaky valve. Instead of the mitral valve has 2 leaflets which close and open as required. If they don't close together, then there is leak within the valve. There are various reasons for that. Commonest is following a heart attack or due to heart failure, various reasons. The left ventricle, which is the pumping chamber of the heart, tends to dilate. When it dilates, then the leaflets spread apart. So that can cause to leak. Other problems can be, as I've already said, due to degenerative age-related or infection-related, or even due to rheumatic heart disease. Some parts of the valve or attachments to the lower part of the left ventricle pumping chamber of the heart can give way. That can also lead to regurgitation, which is in layman's term leak of the valve.
Does these defects actually occur at birth, doctor, or are they developed over a period of time?
There can be defects that occur at birth as well, but most of the problems occur over later in life. But there are few conditions where it can occur at birth and tends to show up later in life.
So how does one get to know that they have a problem? Is there any symptoms which they should look at, or is it picked up through regular health checkups?
Yes, often it is picked up through a regular health check before symptoms appear. And when there are no symptoms and we know, like say commonly mitral valve prolapse, which is a slight bulging of the valve, but it still is intact and not giving way to leak. In those scenarios, we just tend to watch them. Cardiologists will say you have a valve problem, so take precautions like antibiotics when you have a tooth taken out or any major infections, and just follow them. So as long as they follow that, that should be safe. Some of them, that group of patients in middle age, may tend to have problems that the leak tends to appear and get worse over a period of time. Then they will need intervention, mostly surgery. But in some people, it may not happen. They may just live with it for life, which is quite rare. Often it will show up later in life, usually middle age.
Thanks, doctor. So you had mentioned about the mitral valve regurgitation. Is it like a complex procedure again, or is it should be worried about closing the leaks and so?
No, as I said, these procedures are done quite commonly now, and through minimal invasive mitral repair is very successful these days. And we do quite a lot of them. And even recently we did a 74-year-old who went home fourth day without problems. So we do them quite regularly, and even in elderly people. So regurgitation, if it is repairable, that's the best thing we can do. So we will repair and get them off. If we cannot repair, then we'll have to replace. So it's a reasonably safe procedure these days. But repair probably will get their normal life back. But with replacement, they have to, as I've already mentioned, they'll have to follow certain restrictions and tablets for life.
So we've spoken about the surgery for people who might be interested in undergoing a cardiac surgery. But for people who are like the general public, what precautions do they need to take in order to avoid these kind of situations, like to take care of their cardiac health, to maintain their overall health? What should they be doing?
Yeah, so I would say talk here more about coronary artery disease, which is a major killer in our country. So because the valve-related problems are not that common, and they don't occur just because we don't do something right. So it happens due to age or other problems, as I've already said, rheumatic heart disease and so on. But coronary artery disease is something which we can avoid. There are various factors. In our country, we are now become the hub of coronary artery disease in the world. So mostly due to the social stigma, not exercising and not doing much at all, and the good dietary habits which have come up with economic development. I think we have taken the worst from that. It's best to avoid those things. Active lifestyle, compulsory activity would be the best. Say if you can walk to work or do not use the lifts at work, try to apply them. Then it becomes a day-to-day habit. So active lifestyle, and always best to try and give some time for exercise or jogging or running as per the age and time limits every day. That's one. Two, sensible eating. It's not that you have to be on diet. Sensible eating, avoiding or reducing cholesterol food and sugary foods, these things. And if you have a strong family history of heart disease, then it's best to have a health check after the age of 35 to 40. Definitely after 40, maybe earlier if required. So at least once in 2 years. If there are no problems, well and good. If there are problems, then you have to be monitored more closely. These would be my advice to anyone. And never smoke. Stop smoking if you are smoking. So that's one major problem. Diabetes, smoking, blood pressure, cholesterol, and family history are the major risk factors for coronary artery disease. So just try to avoid all these things. Family history we cannot avoid. We have to have health checks and keep a healthy lifestyle. Smoking, of course, we can avoid. Blood pressure, cholesterol, we can control by our activities, food habits, and tablets if necessary. So this would be my advice to anyone in generally our population.
How does alcohol usage also affect cardiac?
Alcohol in large amounts, yes, definitely. Occasional small quantity drinking doesn't affect health. But binge drinking, which is just going and drinking once in a week for a lot, or even regular drinking, definitely has a worse effect on every system in the body, predominantly liver to start.
On an ending note, doctor, like what kind of advice would you give to your to people who would be on the verge of undergoing a cardiac surgery? Like these are things which probably you would notice in all patients, and if you would have felt that if they would have done this, it would have been much easier for them, for you to operate on them, or their results would have been much better. So things like that, if we could share with the public, they'd be more aware.
So for anyone who is awaiting or undergoing cardiac surgery, is that what you're
somebody who is on the verge of undergoing a surgery?
So my first advice is don't fear, because things we have advanced a lot. So there is a lot of advances and the risks are much less now. Say for a straightforward coronary artery disease or mitral valve or valve problems, currently the risk is less than 3%, which is extremely good. So and that's something you have to take your mind off. And if there is a problem, present to us yearly, present to the cardiologist or cardiac surgeons yearly. So problems can be dealt with yearly. It's like what we say for cancer as well. If you see the specialist early, it can be completely cured, most of the cancers. Similarly, here in cardiac problems, if you see the specialist and if they're dealt with early, you can get your life back to normal for the rest, for on the long term. That is very important. So don't put it off and wait, things will get better on its own. That is not going to happen. Seek specialist advice and follow as per their advice. That's one major advice I would give, because that's something we noticed in our country due to various reasons, maybe cost, fear, negligence. Patients present very late as opposed to West developed countries like UK or US. So that's something I would advise. And regular health checks in patients who have a problem or who have a family history of cardiac diseases. Regular health checks, even at the age of 30, would be advisable, so they can just keep an eye on things and catch and treat anything early.
In terms of the technological prowess at Apollo hospitals, would you like to share something about that, Doctor? Why somebody would want to come to Apollo hospitals to get treated, and what sort of advantages they can have here?
Yes, I definitely would, because I have trained and worked in UK for about 20 years and moved back to India. And when I moved back to Apollo, I didn't see any difference. In fact, the technologies here we have in par with any major center in the world. So that's one biggest advantage of coming to such hospitals, and this group especially. So we have the robot, we have the best technical instruments that we need, and we have a very experienced team. So nothing is one-man work in surgery especially. So we need a good team. We have a fantastic team here, so which takes care of any issues post-op, pre-op, and we work together as a team. So that way, Apollo hospitals over the years, I think, have formed an excellent system which is in par with any major hospitals around the globe. And we provide I'm that way very happy to be here and working here to be able to do what I can do at this stage to the best possible manner. So this is the best benefit we can give to the patients.
Thank you so much, Doctor. Thanks for this wonderful session on minimally invasive cardiac surgeries. I think a lot of us would have been enlightened about how we can take care of our general cardiac health, and people who are wanting to undergo surgery, I think they would have understood that there is another alternative to traditional surgery, which will be much beneficial for them. To all the viewers, if you would like to get a consultation with Dr. M.M. Yusuf, you can contact the phone numbers which I mentioned now. It's 95512 77311. I repeat, 95512 77311. Alternatively, you can also contact 99947 99643. 99947 99643. Thank you so much for tuning in. We'll meet in another session of Facebook Live. Thank you.
Thank you.